MonumenTAL was a phase 1 first-in-human study of Talquetamab, which is a GPRC CD3 bispecific T-cell engager. What we determined in the study was the recommended phase 2 dosing, which was 400 micrograms per kilo subcutaneously weekly, given after 2 step-up doses of 10 micrograms per kilo and 60 micrograms per kilo, respectively. This trial was in a group of very heavily pretreated patients who had a median of 6 prior lines of therapy. Also note, 27% of those treated at the recommended phase 2 dose had prior BCMA-directed therapy. 100% of those at the recommended phase 2 dose were triple-class refractory, and 80% were pentadrug refractory. We found that the drug was well tolerated, that cytopenias were mild and generally confined to the step-up dosing in cycle 1. Neurotoxicities also mild in all grade 1 and grade 2. We did see some skin-related disorders in between 60 to 77% of the patients, nail disorders in 21% of the patients. Those were also mild and generally manageable with symptomatic therapy. For example, steroids for the skin peeling on the palms and soles. We saw dysgeusia in about 60% of patients treated at the recommended phase 2 dose, again, consistent with the expression of GPRC in salivary glands and in the keratinized tissue. Notably, in terms of cytokine release, overall it was mild. It did occur in 73% of the patients treated at the recommended phase 2 dose, but it was limited to grade 1 and grade 2 in all patients except one. The median duration of the cytokine release was 2 days, and median onset was also 2 days. The response rate, as I mentioned earlier, was extremely encouraging with a 70% overall response rate. And while follow-up is short, these responses do appear to be durable and deepening over time. 81% of the responders remain on treatment after a median follow-up of 6.3 months. We do have more mature data in the IV cohorts. Even those treated at much lower dosing, we have patients who remain on treatment at 22 plus months. So we remain very encouraged by the efficacy, safety, and tolerability of Talquetamab, and the phase 2 expansion study is ongoing.